Welcome to another mentoring moment with Dr. Mo. I'm Dr. Mo, and in this mentoring moment, we will elevate and enhance your tapping practice by taking a deep dive into kinesthetic aspects versus somatic sensations. Now, despite the fact that both of these things do show up in the body, there is some differences between kinesthetic aspects and the presentation of somatic or body sensations. So in this video, I will be using body sensations and somatic sensations interchangeably, so know that they mean the same thing. So let's first start off by talking about body sensations. And now body sensations, they can easily accompany any emotion or other aspect when using the basic recipe. And usually somatic sensations are generated because your client is focused on some aspect. And as a result of thinking of that aspect, your client feels that as a somatic sensation in their bodies. So body sensations are very common in EFT, and they are what we track when we ask that classic question of, do you feel that in your body? If so, where? And so let's kind of deconstruct this classic question. In this question, the word that is describing an aspect. Where do you feel that emotion in your body? Where do you feel that visual aspect in your body? So let's kind of tie this all together with a couple of examples. So let's say that you and your client are processing a specific event of when your client got lost at a county fair. And your client identifies that the smell of the popcorn is intense for her when she recalls that memory now. So you ask, when you think about that smell of the popcorn, do you feel that in your body? And she happens to respond by saying that she feels a tightness in her chest when she thinks about the smell of popcorn at the fair. So here we are designating that term as being the olfactory aspect, and the somatic sensation that it generates is the tightness in the chest. So in summary, the tight chest sensation is considered a somatic sensation that is in response or that is generated by the olfactory aspect of the popcorn when your client focuses on that aspect. Somatic sensations show up often in sessions, and a technique that you will often use for tracking and processing and resolving these somatic sensations is exactly what chasing the pain is for. But now let's talk about kinesthetic aspects. So these body sensations and somatic manifestations do show up in the body, but they are not the same as kinesthetic aspects. And kinesthetic aspects describe the lingering physical sensation of a past experience that can still be felt in the present moment. So let's elaborate a bit more. Kinesthetic aspects describe external forces or some external acting force that physically affected a client's body at the time of an event, and due to incomplete processing or incomplete resolution of that experience, the client can still feel that sensation or that external force. It's almost like a phantom sensation. And when I say external acting forces, that can kind of sound a bit intense, but these things can exist on a spectrum. So an external acting force can be something quite small, like the physical feeling of a hairbrush on the skin, or the feeling of holding a cup of coffee in your hand. But it can also range to something quite bigger, like the sensation of the airbag popping on one's face. So they exist on a spectrum, but the thing to take away from this is that kinesthetic aspects describe some external acting force that acted on your client's body and was physically felt by your client's body in the past, and your client can still feel that lingering or phantom sensation of that external acting force to some degree in the present moment. Okay, so let's kind of integrate this all with a few examples. And so let's say that you and your client are processing an event of when They fell from a balance beam when they were 5 and they landed on their tailbone. So, for this specific event, a potential kinesthetic aspect would be landing on my tailbone. The external acting force in this example was the beam acting on the client's tailbone. So your client can still feel how it felt landing on their tailbone on the beam in the present moment. And this can be considered a kinesthetic aspect. So let's do another example. And here the example is my arm was yanked to the side by the firefighter. So a potential kinesthetic aspect of this would be the feeling of having their arm yanked to the side by the external acting force of the firefighter. So in this example, the client's body experienced that yanking sensation in the past and still holds that physical memory in the present. So what you tap on is that remaining phantom feeling of being yanked to the side, and that is what you can consider a kinesthetic aspect. So kinesthetic aspects are one of the most obscure of all the aspects in EFT, but I do hope that this video gave you some clarity on how to identify and how to better process kinesthetic events when they do come up in your sessions. So thank you for watching this mentoring moment with Dr. Mo. I'm Dr. Mo, and we will talk and tap soon.